Hi, Alex. How are you?
I am good. Good to be here today.
I'm looking forward to our chat. Welcome to the podcast. I appreciate you taking some time to meet with me and to chat about your work. Let's start at the
Yes.
beginning. Why don't you just tell everyone a little bit about yourself?
Yeah, my name's Alex Smith. I am an enrolled Sac and Fox Nation in Oklahoma and also a descendant of the tribes of Pawnee Nation and the Otoe Missouri tribe here in Oklahoma. I actually grew up in Pawnee, which, for those that don't know, has never been to Oklahoma. If you go to Stillwater country and OU country, those are kind of, uh, Bedlam rivals. So Stillwater's about 30 minutes from Pawnee. So that's the closest city from Pawnee, but little small town community that I grew up in and was fortunate enough to have a pretty decent normal childhood. Of course, and looking back on it, in retrospect, that there's a lot of things that helped me good and bad, as it raised me up, and that includes mentors, experiences. But yeah, and here I work with the Southern Plains Tribal Health Board as the creative director um, and slash communications. But I have been here going on 8 years in this position. So I'm oversee the department. We have three people in our department and a CDC tribal field rep who does our social media. But yeah, I've been here for almost 8 years and enjoyed it, and it's been pretty cool experience.
Yeah, I like that title too, creative director.
Yeah,
Um, I have more questions for you about that. But before we get into kind of more about what you're doing currently, let's go back a little bit. I love to hear the journey to this point. So, like, do you remember when you first became interested in or first learned about public health?
um, honestly, I got hired on here at Southern Plains Tribal Health Board, and that was I don't think it was the first time I heard tribal or public health. The phrase public health. I have to really go back to my high school years, and I was talking to my one of my family members, my cousin, and we was talking about one of the organizations that we had. It was called Northern Plains Indian Club in Pawnee, um, and basically it was just consisted of a lot of us natives that were in the Pawnee community and mostly Pawnee, but there was some other tribes in there. But there was a psychologist who came in that was hired in to come in after school to speak to our club then, and her name was Data Star, I believe. But she was a native lady that you know I think the first time we went to a counseling session, it wasn't called a counseling session at the time, but I think it was just, hey, the director told us, hey, someone's coming in to talk to us and talked about native issues. And so she came in, and I remember the first time, she kind of made us feel uncomfortable because, in a way, natives from our native family perspective, like it was hard to communicate, much less be vulnerable. So she was pushing that vulnerability issue, and it was very uncomfortable. So there was a lot of crickets at first, but I think as we got into the second, third, and fourth session, where everybody started opening up, and that's where I first heard the term public health and tribal indigenous issues, and that was way back in. I'm gonna date myself. That was back in '93, '92. But
Yeah.
yeah, I think that was the first time I ever heard that term, and then It kind of came full circle when I got hired on here to be the creative director and to bring um, kind of a innovative style to this communications that we needed here, especially in these days and as we live in a digital world. But I was hired on to push some of that forward and do it through a creative and innovative way. But yeah, that's some of my memories back then of when I first heard the term public health.
I like that story a lot. And I also like how, um, even as you describe, retrospectively, that encounter with the psychologist, you kind of pushed and it was uncomfortable. And, that was a challenge of communicating then. And here you are, fast forward to current role where you're the creative director slash communications director. You're, that is a very interesting point back in the day that I would say had some sort of a role in where you are now. Would you agree?
Yeah, I think it definitely helped me look at how to communicate. Like it not only with my peers at the time, my friends, because I was kind of shy. I still am really, but it's funny that I'm in the communications work because that was kind of my biggest problem. Even going into college courses, the scariest courses, of course, was public speaking. And
Yeah.
so back then, uh, my family really didn't. The dynamic of our relationships inside our home, well, communication wasn't our strong point. So, and
Yeah.
basically our apologies, but hey, do you want something from the store? That was our apologies. So, um, so it helped me open my mind and kind of look at communication. And um, she gave me the courage, stay to star. She gave me the courage to not only approach her about questions and curiosity about communications and public health, what the issues are then, um, but she also opened my mind to like, hey, this I know this is a complex thing for you and your family as far as being communicative and being able to talk to each other and being vulnerable. But that's what it's going to take to move forward in some of the things that you're going through. And at the time, I kind of she had to peel me back in little layers. I was an onion, so and as she peeled more layers back, I got more vulnerable, and I kind of like the feeling, and not the feeling of being uncomfortable with or being comfortable with uncomfortable conversations, is what I used to say. But I love the feeling afterwards. Like the
Yeah.
perspective, like you're
Hmm.
learning more about yourself, even at a young age in your teens, and you're learning about relationships and how what dynamic those make of, and how to approach other relationships within your family. So that kind of started my journey of like this complex issue, and I had this shell around me and being shy and you know wasn't really the type to use my voice or share my story. And it's funny, like fast forward to now, that's exactly what I do. And there are a lot of different advocacy efforts that are personal to me that I do, that I share my story that have helped me not only advance certain issues within our communities, but also things that we need as far as resources. So I can share more about that later.
Yeah. Yeah. I uh I'd love to know more. Let's talk more about what you're currently doing. I really appreciate that story and you sharing even with us about your journey to this point and how this So I wonder if you have a way of connecting with her, what she would think about where you are now compared to if she even remembered some of the details. But we never know who we impact in our work. But tell me more about your role. You're currently what you do and as a creative director.
Yeah. So I think what a lot of this is what we're dealing with now is um, leadership in a virtual world. and how we approach communications in a different way. And but I guess a lot of what I'm doing now is um, trying to make public health and epidemiology, those complex things that uh, are part of our makeup and what we do as an organization, what we do as a staff, and what our role is in our communities as far as helping our tribes. That's it's such a complex ecosystem that we're in, for health services for tribal nations, and we're just one part of that whole ecosystem. So it's right now we're really trying to break it down to be more understandable and put forth some kind of understandable educational materials, videos. We're looking at podcasts. We're looking at different ways that we can stay connected to our communities, and I think that's a lot of the organizations that are in my work that we're trying to do is to stay connected to each other, to our communities, to the people we serve, and that goes internally too. So there's a lot of internal things that we're working on to um, keep each other connected, because as we're growing, I think just within a few years we went from 20 staff to 70 staff. So now that we're that large of an organization, I think we're in a category of medium size now, but um, some of us are working, some of us are working from home, teleworking. Some of us are hybrid, work from home and at work. Some of us are full-time office. So there's a dynamic of that communication now that we're using anything we can to stay connected, whether that's tools and videos, or even like the dynamic of our meetings. We're trying to constantly change and adapt to make sure that we know each other, like especially our new staff. When they come in, it's we want to make sure that everybody's kind of getting their due, and we're not just a title. So,
Right.
but
Yeah.
for the most part, yes, that's what we're doing, is trying to um, put out educational materials, and as far as my department, really helping the programs thrive too. So I don't want to forget them. They'll get mad at me if I don't mention that. No, but um, making sure the programs thrive, and there's so many different issues that we hit on in the communities, and they're amazing. Our program managers are amazing, so we want to make sure that we're promoting and serving health, serving and strengthening our tribal nations as best we can.
Yeah, I agree with that. Everything that you mentioned, is it calls for creativity in how we can't. There's no cookie cutter approach to how we communicate, and the times are changing. People are different. The dynamic of our work environment, the communities. There's so many factors in it really in play. Even what worked 3 years ago doesn't work today. What works today may not
Right.
work 3 years from now. So we have to always be thinking about that and kind of on our toes. Um, could you take a moment and kind of describe uh, the population that you serve through your tech and some of the communication challenges that you've seen or that you're addressing?
Yeah. So Southern Plains Tribal Health Board, we serve the 44 federally recognized American Indian tribes in Kansas, Oklahoma, and Texas. Um, we also reach out to urban Indian health centers in Tulsa, Oklahoma City, Wichita, and Dallas. But Southern Plains serves the largest Indian health service user population area in the United States. Um, but that's that covers a lot of area, a lot of communities, and a lot of tribes. And so I consider, just like I said earlier, one of the goals is to make resources available and uh, really promote the awareness of what exactly we do. So tribal nations and tribal people know exactly where to get those resources. So partnerships is a big thing for us. So we partner with a lot of tribes, a lot of tribal nations in developing programs within their communities. So that's an ongoing effort, of course. What was the second part of that question?
Just some of the like you great job of describing the population. Like what are some of the communication um challenges, I guess I could say, like that you're facing, that you see, maybe you're addressing them or you're really aware of in your community?
I think I'd go back to um, that leadership in a virtual world. Um, there's actually some of the things that I'm reaching out for as far as educational materials for myself and actually for my department is how to put people first in a digital world. And so, any thought leaders out there that authors that have books or training materials or conferences, um, actually just participated in it's a communication director mentoring program. It's by Kivi LaRoe Miller. She actually runs a nonprofit that helps communication directors and nonprofits. But it was about 6 months, and there was 12 of us. She can only take 12 every 6 months. So there's 12 communication directors, and we just meet virtually. And some of them are from nonprofits, some of them are from universities, small companies, medium-sized companies. I think I was the only one in my group that had public health background, but in those meetings, we just shared resources and tips and things that uh, were that we learned through our own experiences, through our own work. So we shared a lot of that stuff online and some of the resources that we can use and share with each other. We had mentoring side groups, so I linked up with other members of that group in LinkedIn, and we shared resources there. So it helped me kind of develop things from their own perspective and vice versa. That I let them know about some of the things I'm going through with our staff as far as making sure that we stay connected. And I know that social media is a big thing now, as it has been for a while. But pre-pandemic and post-pandemic communication is starkly different. It's very different. It's so pre-pandemic we maintained connections, typically in person, and then post-pandemic it was pretty much all virtual. We had to respond and adapt to a lot of different things that we didn't know about. So there was some things that we had to implement within our organization to make sure that we're staying connected. The work is moving forward, and in regards to social media, they always call them like connection platforms, but I I don't believe they're connection platforms. They're communicating platforms. Connection really requires something far more complex, and I think connection in regards to relationships, that's really key, is to make sure that we're staying connected on a human level, so that um, social media, as you know, it could be a um, very uh, volatile at times, because in communicating with people online, it could be. somewhat bullying. There's been times that my own family has reported things online that has affected them mentally. So there's just a thing about social media that there's just about likes and um, hearts and all these things that are not really part of connection. There's just so it's just we're trying to make sure that we're staying connected and trying to make sure that relationship is the core goal for the reason of adapting to these things in our lives.
Yeah, yeah. Well said. I think that it is interesting. All of I wrote down here. I'm just taking a lot of notes as you were talking, but communication in a virtual slash digital world as being kind of the that main challenge, and I think that's something that we're always we need to just keep it top of mind, constantly reviewing what's working, what's not working, and so forth. You also created, you had a very special project that I want to talk about a little bit. You created a video that's on the website. I think it's on the main Tribal Epidemiology Center's website. It's called What is a Tech, which tech stands for Tribal Epidemiology Center. So, can you
Right.
tell me about that project? Like, I'm really curious to know what inspired you to start this and how well were your ideas received. Tell us about that process.
Yeah. So Kristen Mitchell, of course, Kristen. She approached us a few years back about doing this project for what is a tribal epidemiology center, and it goes back to that point I was making earlier about health boards. There's such a complex health ecosystem that we're in. So for tribes that don't know what public health is, how are they going to know what epidemiology is? How are they going to know to use these resources that tribal epicenters offer to them? So that's where the idea came from, is making sure that we provide or do something with um, a media project that really just brought awareness to epicenters and the resources that they can offer tribal communities. As you know, there's of course 12 tribal epicenters across the nation. We're one that serves Oklahoma, Kansas, and Texas. So we wanted to make sure that we was talking to all the leadership across those 12 TECs and just kind of get their perspective, their stories, their experiences, how they approached work and how they did things within their own tribal epicenter with their communities. And, um, you know, I think there was a lot of words like resources and relationships that were mentioned in that video, how important those were with the communities because, our tribal communities, our tribal nations, they pretty much hold their own stories. So we're just trying to push that story forward in a healthier way. So Abigail Alcoholic was one of them, and she was one of the first ones that we reached out to because of the data she had. That was kind of her area of expertise, if you will, when she was talking about data. So that we've always been part of. That has been part of our story for a while. So to reach out to her and to make sure that we got her voice as part of this project was very important to us. Um, and then there was a few others. There's too many to name, but there's so much story, so many different things, and that were shared during that project. We really had fun, and going to Alaska was, just a bonus for us, and got to experience a little cooler weather and the mountains around us. So it was pretty fun for us.
Nice, nice. I'll make sure that we share, provide a link to that video. It's on the website, but we'll link it in the show notes so that our listeners in this episode can visit the website and see that video. I thought it was just a great example of creativity and really bringing to life the, you know, the stories, the collaborative stories that represent the 12 individual texts that all come together. So I personally like it and I encourage people to check it out. I How long did it take you to complete that project roughly?
Um, I would say about 9 months from
Yeah.
beginning to end. So pre-production, production, and post-production. I would say about 9, 10 months. Yeah, and
Yeah.
so we wanted to make sure that we uh, was hitting all the right communities. I think ideally we would have loved to travel and go to these other health boards and TECs across the nation. Of course, within the time range, you're always dealing with funding. So the funding part is, we wanted to make sure that we hit an event where all the TEC directors or all the program managers or people that were part of these other TECs and health boards were going to be at the same area. So that's why we chose
Mhm.
Alaska. So they all came up to Alaska, and we was able to set up a interview place for for that area. So it worked out. But in hindsight, we always want to make the best product, and hit the goal, of the piece that we was doing. So I think we hit that goal as far as the project itself. But
Yeah.
um, like I said, ideally we would have loved to talk to more people, and but you know, just it
Yeah.
just didn't work out like that.
I think you guys did a great job. Um, so I have a question for you that helps connect the dots for people
Hmm.
when it my audience of listeners of the podcast is very diverse. So
Hmm.
people who are students, professionals, entrepreneurs, and anywhere in between, could be listening. So really kind of connecting the dots with epidemiology in an applied way, not looking for a textbook definition from you, but just in your own words, can you describe how epidemiology is important in the work that you do and the communities that you serve?
Yeah. So we first heard that word, you know, back in, what is this, 2023? So about 2015, and I think 94 was around the time that TEC's epidemiology first came about, as far as um, being funded, and being part of the health board system. But yeah, epidemiology, I think the data would speak for for itself. I think a part of me personally deals within the autism world. So I'm actually a dad to a 13-year-old. My son has diagnosed autism. So I deal a lot with the autism community here in Oklahoma, but also Autism Speaks. I have done a lot of advocacy work there. I'm also part of a strategic planning board with the Autism Foundation of Oklahoma. Um, to have that kind of data on hand when you go to speak to policy boards or to speak to legislations, um, to try to get policy change. I think one of the things that comes up in my memory, as far as a story of how that data changed some things that were necessary in our community, was that Medicare, Medicaid wasn't covering certain things when my son was younger. Um, as far as seizure medicine, I think he was having seizures at the time. I think he started having seizures around 2 years old. and the autism centers were not taking certain insurances, so Medicaid, Medicare wasn't being taken to cover those expenses for uh, like let's see, ABA therapy, which stands for Applied Behavior Analysis Therapy. So a lot of that work we done with Autism Speaks and people here in the community, when we went and advocated on behalf of coverage, full coverage, or even some coverage, really revolved around speaking some of those statistics and facts. The prevalence of autism. CDC reporting that approximately 1 in 44 children in the U.S. is diagnosed with autism spectrum disorder. That's 2018 data, but I know for me, the one that hits most was 1 in 27 boys identified with autism in that data, and 1 in 116 girls identified with autism. So boys were affected more. Um, and I always want to hit the head and the heart. So in my approach with, trying to change that policy, when I was speaking to people on those policy boards and the Medicare, Medicaid um, reviewers, and also there was some people there from tribal nations and legislative representatives from Oklahoma. It was kind of a sobering experience because it really centered around my son's story. And so when I walked in there and I was given the floor to speak, I remember sitting around this round table, and there was nothing but policy people and tribal nations, and there was some people in there that were all about black and white. The people that they see as far as our statistics were concerned. They seen a piece of paper going across a desk, and that's where I basically told my story. Like, my son's name is Nathan. I wanted him to be here today. I really wanted to let you see of what we go through. I was like, if we had coverage from Medicare and Medicaid to cover these behavioral expenses at an early age, we could be maybe communicating better, or maybe having uh, these professionals in behavioral work find those little puzzle pieces that fit, and which is why Autism Speaks uses those puzzle pieces. And it really is, autism is, trying to find different puzzles. I actually did another video called Chasing Hope, and that's sharing a bunch of our stories that were a part of a panel. And that's what I told them. I was like, basically, I'm chasing hope. This is why I'm here. Your hope. And I don't want to talk to you as a policy board reviewer. I don't want to talk to you as a Medicare, Medicaid. I don't want to talk to you under your titles. I want to talk to your heart as a parent, as someone who knows what it's like to raise kids, without autism, without special needs. So you add that complexity of special needs and autism into the mix of your family, that changes the whole dynamic. And we've been having to learn as we go along as parents. So I've had to reach out and find resources myself. I've had to struggle with um, taking care of my son at night. When he's struggling with seizures, when all I'm getting is denials from uh, trying to take care of my son with medicine. And I'm exhausted, and I really am reaching out to you to find a way to change this. And so I told him about two stories from Nathan's point of view and what it's like to raise him. And um, I think maybe through 2 or 3 years down the line, that's when we started getting some traction as far as change. And I think about 4 years it took to finally. I got the email from one of our partners that said it. Well, we did it, full coverage. They just approved it. Autism or behavior ABA therapy is now covered, is it fully covered. So that was a big win. It was bittersweet in a way because you know it would have been cool to have that coverage and that help, that those monies to help my son at an early age. Of course, he was older. Now he was kind of aging out of some of these autism centers because at maybe 8, 9 years old, sometimes 11, 12, they age out. So he's 13 now, and most of them he aged out of it, so they won't accept kids that age. So that's another fight for another day. But yeah, it just shows for me personally epidemiology. Showing the data. I always like, that's what I tell our staff, like hitting the head and the heart. That's what we have to do. Like we have to make sure that they know the facts, but they also want to make sure that we're speaking to their heart.
Mm. Thank you for sharing that. A little speechless, but I definitely agree with you. You hit my heart for sure. What an incredible story, and what an incredible way to uh, to see the value of epidemiology, both personally and then applied to the work that you're doing. So really appreciate you sharing that. So I have one more question for you, and then we can wrap up. I'm really enjoying our conversation and getting to know you, and all the stuff that you're sharing is amazing. As I mentioned earlier, we do have a very diverse audience of listeners of the podcast. And I'd like to know if you have any bit of advice or tip that you'd like to share with someone who may be listening and also interested in working in, maybe working with tribal communities.
Um, any advice? So I always look at the communities as one big family. It's really about having a servant mentality or a servant's heart, a servant spirit. And that's the thing I'm struggling with these days, especially online. When I actually had to deactivate Facebook, and I did that just because of so much negative things going on. And of course, there's the the political ugliness going on, of course, all the time, and there's always things out there that. So I had to deactivate it just to kind of get my bearings because at the time, I'm going on 2 years sobriety. So in my own journey, I had to unplug and really just focus on improving myself, improving my health and well being, improving mentally, being focused on my son, and giving him resources. So a lot of the things that I see out there are really selfish instead of selfless. So if we have that selfless mentality, I think we can all get along better as a community and really take advantage of helping each other along. As being a healthier community. But for the advice, I would just say be curious enough to find those resources and don't be scared to reach out to an organization like ours or even your tribe. Like if you're a tribal member or even if you're non-tribal, just reach out and ask about these programs, ask about what's out there and resources. So it depends on what you're affected with. That I think a lot of the things that are going on now within our indigenous um, indigenous communities, you know, I think fentanyl is a big one. You know, the opioid epidemic is a big one. So it depends on what you're affected with. You could be like me. You could be a parent that's, you know, kind of trying to help their son or daughter get better resources. You know, improve our situation within our family, improve his situation, you know, as far as behavioral. Um, so I work with the communities. I work with the school systems. Um, I work with behavioral health centers outside of this job. So that's kind of what I do outside of the creative work. So I'm always looking for resources, and I think that's what my best advice is, to be curious and to make sure that you're reaching out, because there's a lot of resources out there. We're just one of them, but we're happy to, you know, share those resources. And if we don't have it, we'll point you in the right direction, that to a tribe or organization who does have those resources. And I think that's one thing that we're trying to do, is simplify that, you know, all these resources that are in within our communities. Like, you know, we're working with partners that to make sure that those are available, and we're promoting those on our website. We're using our social media channels to make sure that, hey, these are our resources. If you need them right here, this is where they're at. So, but yeah, that would be my advice, is to make sure that you're reaching out, you're asking questions. If you're curious enough to be, I guess, start a career in public health, man, I'll have to give a shout out to one of our programs. It's called Thesis. I forget the acronym, but it's Thesis. That's the acronym for the program. But they're starting um, a mentorship program for uh, building curriculums for uh, tribal health students that are wanting to learn more about tribal health, and we're trying to promote that. That's kind of in the early stages, but it's a great career to be in. It's very rewarding. You know, you get to learn about your people, you get to learn about um, the situation within the tribal public health realm, all the issues that are going on. I think also too, I don't shameless plug. There's our conference coming up. Our tribal public health conference is in April. That'll be in Durant, Oklahoma, at Choctaw Nation Casino and Resort, and that's basically a stomping grounds for all of these leaders in tribal public health. That's all going to converge in 3 days to share all of these resources. I actually tipped off some of my family who's in the health realm, counseling, therapies, psychologists. You know, um, man, there's just so many different people there that you can kind of build off, learn from, educational materials. There's trainings, um, great, great speakers. I think one of our speakers is Dr. Evan Adams, who was on the Smoke Signals movie, Thomas. So, but he's one of our keynotes. In any case, yeah, I'm kind of giving a long answer to a short question.
No, that's good though. I actually am familiar with that conference. I had someone that was somebody had submitted an abstract, and it was not accepted. But if it had been accepted, I was planning to attend to support her as well. Um, Still haven't completely crossed it off because it may be doable, but that's this at the time we're recording this at the very beginning of February. It'll air. They won't have much time to actually plan for the conference, but we'll try to get a link in the show notes at any rate for people that may be interested. Thank you so much for taking time and sharing so much value on this episode. I've learned so much. Just really enjoyed hearing from you and your stories and responses. And I so admire all of the stuff that you're doing, both the creative space, with your organization, the work that you do in the community, how you advocate for your son. Congratulations on 2 years sobriety. You're doing just
Yeah,
amazing things all the way around. So I really applaud you.
Yeah,
Thank
I
you
feel
for
like we
being
can have
here.
this conversation for another hour. I
Yeah. Yeah.
appreciate it.
All right.